Alright, let's talk about the costs and benefits of abusing loperamide or Imodium. Disclaimer, benefits are satirical, don't abuse loperamide. Peppa Pig is joining us for this video. She says don't abuse loperamide, listen to Peppa Pig. The benefits. Number 1, it can help with opioid withdrawal, albeit there are much better alternatives available. 2, it's good if you have diarrhea. 3, when abused, you can get high. Loperamide is a synthetic opioid. It's in the drug class of phenylpiperidines, same drug class as fentanyl. This is loperamide, this is fentanyl. Same drug class as diphenoxylate. This is paired with atropine, branded as Lamodal. It's a Schedule 5 controlled substance used for diarrhea. You have to take a shit ton to get high, pun intended, because although it has high lipophilicity and high affinity on the mu opioid receptor, it has poor oral bioavailability, less than 1%, due to extensive first-pass metabolism, and then it also has poor penetration across the blood-brain barrier. You have an efflux pump called P-glycoprotein, or PJP, in your brain that takes toxins and loperamide and throws them out of the brain. At very high doses, loperamide can saturate these PJP efflux pumps and produce euphoric effects. Some drugs are PJP inhibitors like quinidine, ritonavir, and to an extent omeprazole. Some people will take PJP inhibitors with loperamide to increase CNS penetration. There are also drugs called CYP inhibitors that inhibit the metabolism of loperamide. Some examples are classic grapefruit juice and Tagamet. So people will take CYP inhibitors with loperamide to increase bioavailability, plasma concentrations, duration of action, and again, decrease metabolism. Now let's talk about the risks. Abusing loperamide could technically cause respiratory depression and is profoundly cardiotoxic in excess. It can cause ventricular dysrhythmias, which is really fucking dangerous, QT prolongation, torsades de pointes, and sudden cardiac death. Narcan does not reverse these effects because it's not due to opioid activity, but blockade of channels on the heart. I would argue some drugs in the street are safer. Another risk with loperamide abuse is addiction, tolerance, dependency, and withdrawal. It is an opioid. Another thing, it's a very expensive addiction. Whoever called it poor man's methadone, I just want to talk. Let's do the math. You can buy a stock bottle of 200 for $20 online. Let's say you're dumb and you buy the 24 count in the store. 2 milligrams each, so 48 milligrams per box. When looking at misuse and abuse, doses seem to range between 70 and 1600 milligrams daily. On the lower end, that would be 2 boxes, so $24. On the higher end, that would be 33 boxes or $400 for one dose, but I doubt that anyone's taking that much. I have heard of doses of 200 tablets for one dose, but let's say someone is taking 100 tablets a day for a week. 100 times 7 is 700 tabs a week, divided by 24 is about 30 boxes, times 11.99 is about $350, or about $100 if you're buying these online. I'd rather spend that on DoorDash. That doesn't include the cost of CYP and PJP inhibitors or the hospital bill once you're hospitalized if you don't die first. Another issue with loperamide abuse, as if that already wasn't enough, is that society has determined that abusing loperamide and antidiarrheals is embarrassing. Another issue I'll mention is constipation. It has a long duration of action. All in all, this video is an attempt at harm reduction. I believe that everyone should be aware of this. If you're struggling with substance use, talk to someone. Talk to your provider. Talk to your pharmacist. There are treatments available. I will mention that pharmacists prescribing a Suboxone as medication-assisted treatment is picking up speed in a lot of states. Since the X waiver was removed a couple years ago, now there's no limit to who can prescribe buprenorphine for opioid use disorder. There's also no limit now to how many patients a practitioner can see. Listen to me when I tell you this is an awful way to go.